I am Dr. Jamal M Mohammed, MD. I am the Assistant Clinical Professor for University of California, Davis. I am also the Medical Director for University of California, Davis Sleep Lab. I am also the Sleep Physician for Veterans Affairs Medical Center, Northern California Health System. I am also the Co-Medical Director of California Sleep Solutions Sleep Lab. So sleep medicine as a field is relatively new in the United States, and in India it's still in the process of picking up. The challenges that I state would be that in India you have patients who have to be seen within a short span of time, and unfortunately the physicians do not have enough time to spend with patients. And two, the physicians who practice sleep medicine in India also practice other subspecialties, and hence their time is much divided between there's other subspecialties and also sleep medicine. Whereas in the United States, even though we do practice sleep medicine in along with other subspecialties, but some of the physicians exclusively practice sleep medicine, as I do and many other physicians do. And the other point is that there are certain treatment options that are available for certain sleep disorders, such as using something called continuous positive airway pressure for obstructive sleep apnea, which is the most common sleep disorder among the entire world, and this equipment is usually a little expensive, and it's tough to be affordable to the patients here in India. Whereas in the US, our system is a little different, wherein your insurance companies cover most of the healthcare costs, especially the machines that are expensive mostly are covered by the healthcare industry, the insurance companies in the healthcare industry in the US. As I mentioned, general physicians do play an important role in diagnosing and managing sleep disorders. Patients first go to their general physicians with any problem. If the general physicians just ask a single question stating, do you have problems in sleep, most of the patients are going to say probably not. So hence it's very important that there is public awareness, and also there is awareness among the general physicians about various sleep disorders. If you look at the international classification of sleep disorders, there are various types and varieties of sleep disorders, and sleep disorders is a multidisciplinary approach. So patients can have problems with excessive daytime sleepiness, and that could be because of a neurological condition, or it could be because of a genetic problem, or it could be because of problems with gas exchange in their body. And or it could be also because of the most common sleep disorder that I mentioned, which is obstructive sleep apnea. So hence the neurologists, and it's a multidisciplinary approach, combination of the neurologists and the pulmonologists and the ENT physicians and the dentists, psychiatrists, psychologists all intertwine and try to help the patients. So when a patient goes to see a primary care physician or a general physician, it's very easy to miss these sleep related problems, because patients do come with other medical problems, and sleep is sometimes pushed towards the end. And at the end, if the patient even states that they have a sleep problem, sometimes it does go unheard of by the physicians, because just as I mentioned, lack of time and giving priority to other medical problems. As the literature suggests, and as the data suggests, and so as we all know, that untreated sleep problems can lead to various health consequences for the community. So here the general physicians can at least start screening patients. If they don't have time to ask questions, they can use questionnaires that have been standardized for various sleep disorders. For example, obstructive sleep apnea, as I mentioned, is the most common sleep disorder. The simple questionnaire that they can follow is something called the Stop Bang questionnaire. There are also many other questionnaires, but the easiest one to follow is probably the Stop Bang questionnaire, wherein S stands for snoring, T stands for daytime tiredness, O stands for observed apneas, if somebody has noticed stopping breathing by the patient, P stands for high blood pressure, if the patient has high blood pressure or if the patient has been on medications for high blood pressure. B stands for BMI, body mass index greater than 35, which compares your height and your weight. And A stands for age above 50, N stands for neck circumference above 40 centimeters, and G stands for gender, being a male patient. So if you have a score of 3 and more of the Stop Bang questionnaire, you have a high chance, you have a high probability of having obstructive sleep apnea. And the more higher the score, the more high chance of having obstructive sleep apnea. And also the other questionnaire that can be used is something called the Epworth Sleepiness Scale, which is a questionnaire that can be provided by the general physicians to their patients. Wherein they fill in, it gives you an idea of how sleepy the patient is. Rather than just being tired, the patient will tell you how sleepy it is. And if they're very sleepy, you could you combine both using the Stop Bang questionnaire and the Epworth Sleepiness Scale, and then compare if the patient has the most common sleep disorder, which is obstructive sleep apnea. And then there are different tests to test obstructive sleep apnea. You have the home sleep test, which can be easily used on patients who don't want to come to the sleep lab and sleep. If the patient has other medical problems, such as heart disease, lung disease, we can certainly have them have an in-lab study wherein they come to the sleep lab and they sleep at night, and you diagnose sleep apnea, which could be obstructive or central, or they could have some breathing disorders such as hypoventilation syndromes, and those things can certainly be diagnosed via the in-lab sleep study. And hence the primary care physicians, if also the media, we can motivate patients, and the primary care physicians can get more awareness in terms of how to diagnose these sleep disorders by using certain standardized questionnaires if they don't have time to spend with the patient. And the other point is trying to get an information on how the patient's sleep is, how many hours of sleep they're getting, what is the bedtime, what is their wake up time, how many times they're waking up in the middle of the night, and what are the symptoms they have that could suggest towards having a sleep disorder. And as I mentioned, they can also use a questionnaire form that can be given to the patients while they're waiting in the waiting rooms, and this will help manage their sleep problems, and if the need be, they can be referred to the sleep physicians who are there in the community, and that will help the population in a large scale.